Kia ora koutou. Thank you for your patience and welcome to the very first Health and Safety webinar as part of Creative New Zealand's Capability Building Programme for this year. My name is Helen Bartle and I'm the Senior Advisor for Audience Development and Capability Building at Creative New Zealand. It gives me really great pleasure to introduce today's topic, the big things. And this webinar is going to improve your understanding of the new health and safety legislation and will provide insight into developing a health and safety framework and policy that underpins what you do next. Our presenter this morning is Steve Lloyd of Coverage Solutions New Zealand Limited, and he will break down what the new changes to the Health and Safety Act may mean to you. He will also look at the basic framework for a health and safety system, including health and safety policy, health and safety management plans and document repositories. Today's session will last for an hour until 11:30, and there will be an opportunity for you to ask questions halfway through and at the end of the session. If you have a question or a comment during the presentation, just note it in the chat box on the left-hand side of your screen, and Steve will answer it when we break. Both the recording of this webinar and the PowerPoint presentation will be made available via Creative New Zealand's website, in fact our YouTube channel, for reference after today's session. So without further delay, welcome to you, Steve. Can you hear me?
Absolutely, Helen. Thank you very much for the introduction.
Great. No worries.
I'll take it away. Hey, thanks everyone for dialing in. A little bit about me. I've spent the first 15 years of my working life in the oil industry. They tried to kill me a couple of times, so I got out of that one and came back to New Zealand, where I started a telco company in Wellington. We spent a lot of time designing and building cell sites. Nobody likes them, but everybody needs them. The company that I was running got bought out in 2004 by a bigger telco company, and then in 2007 by a bigger telco company. I disappeared over to Australia, where I carried on in this industry, working in telecommunications, building cell sites for Telstra, Optus and Vodafone. That was in 2011, 2013. And during that time, the Australian government introduced this health and safety legislation. And essentially, New Zealand's done a cut and paste of that legislation, which is what we now know as the Health and Safety at Work Act 2015. In the last 2 years, I've worked with volunteer organisations, particularly Musical Theatre New Zealand, looking at the impact of the new legislation on their worlds. MTNZ, as an example, has 86 societies around New Zealand and 4,000 volunteer members. So the new legislation had potential to impact that environment. I've been involved in theatre for over 40 years in a technical capacity. Currently a member of the Entertainment Technology New Zealand, the New Zealand Institute of Safety Management, and I'm just completing a postgrad in Occupational Health and Safety Management. I do a lot of my work in the arts voluntarily, simply because there's a lot of scaremongering going on at the moment. So without further ado, we'll get into the presentation at hand. Just load up on that. If we watch this little scenario, we see something or someone doing something they probably do every day. But the circumstances changed here today for some reason, and the thing that person was doing has changed, and the environment's changed, and as a result of that, this poor gentleman was involved in that accident. He's obviously pallet jacking a rather large piece of equipment. That equipment gets to the end of his tail lift, it then drops over. He's trying to save it all the way to the end, but unfortunately, he's not able to do anything other than be impacted by the laws of physics. He survives, he gets up, he walks away, but he has injuries. This is what we're sort of talking about in this presentation, is we're looking at the circumstances surrounding why things are happening in terms of the various industries that we're representing. And I guess in a way he was lucky, and he probably won't make the same mistake again. Now, I kind of apologise for this question, and I don't apologise for this question, but it may make some people feel uneasy. You may know the answer, or you may have an idea, or even know someone who did not come home from work to their family. This number is the number one primary reason for the overhaul of the health and safety laws in New Zealand. And if we skip to the next page, That's the number of people who did not come home so far this year. And I say so far this year because I've been doing this presentation for over 2 years now. And at the beginning of the year, that number's always 0. And unfortunately this year, we have 42 individuals have not come home from work. Now, if you have a look at the trends underneath those numbers, 2013, 57, 14, 48, 2015, 43. We're at 42 now, and it looks like we're going to be similar numbers to last year. So what those numbers are telling us is we're not really learning or applying learned knowledge at work at the moment. If we sort of have a think about the underpinning statistics as well, and look at how many people we've seriously hurt at work so far this year, and in particular how many of the arts and recreation sector, we find some pretty scary numbers. But there's also some good news. Seriously hurt means we had to send them to hospital due to the nature of the injury they received at work. They didn't go home, probably with all the bits they came to work with. But there is a good news story in these numbers. If you have a look at 2016, we're less than half. There's less than half serious harm going on, and we're not seriously hurting as many people as we were. But if you remember the previous slide, we're killing similar numbers. So statistically, the numbers don't add up. If we're hurting less, we should be killing less. And this is where the government has taken a lot of focus, and they're looking at the industries where people are actually being killed at work. This is the construction industry, the agricultural industry, the forestry industry, the mining industry, and even the outdoor adventure activities industry. In the arts and recreation sector, we do less harm with over 80% of the injuries stemming in the recreation sector rather than the arts sector. So non-work injuries in the recreation sector have been excluded from these numbers. So overall injuries in the arts and entertainment industries are low. But that doesn't mean we can't do a better job of managing the risks in our industry. Normally in my presentations, I'm normally doing them in front of people, and I ask participants to put up their hands, and when I ask them the question, do they consider themselves to be expert risk managers? By the very nature of human beings, we are actually excellent risk managers. We mostly do this through patterns, though. We absolutely love patterns as humans. I can guarantee that you clean your teeth the same way every day, and I can guarantee you have a shower the same way every day. And in terms of risk management, as an example, if it's dark and we need to get up and go to the loo, immediately we assess the need to turn on the light based on the last conversation we may have had with our partners. Typically, we go down the let's not turn on the light path and proceed to manage the journey to the bathroom through memory of steps to take and extended arms and the shuffling technique. This is risk management in action. We get up in the morning and determine if it's safe to get out of bed when we go and have a shower, and this is the most dangerous activity that we can do according to the ACC stats. The bathroom is the single most dangerous room in a home, yet we manage the associated risks and continue on our perilous journey to work, like we do every day, managing risks as we go. The new legislation introduced by government shifts the focus from hazard management through to risk management. It's a titanic shift in the mindset and the culture of an organisation to get their head around. We've seen that New Zealand companies are very good at identifying the hazards that exist in their industries, but we fail dismally, and that's a generalised statement based on the previous statistics, at understanding the risks associated with those hazards and managing the controls and implementing controls to reduce the exposure to that risk. What we're talking about today is putting in place a management system to support the management of risks and to help with the compliance nature of the new Health and Safety at Work Act 2015. So, as of the 4th of April this year, the Health and Safety at Work legislation became into effect. And in association with that Act, the HSWA Act, or the Health and Safety at Work Act 2015, regulations are also coming in right now as well. The regulations represent a summary in everyday terms for the non-legal of us to understand the intent of the various sections of the Act. For instance, the first regulation is called the General Risk and Workplace Management Regulation, and it deals with the expectations of how you should apply the Act to your work environment. And then one of the key elements that we're going to talk about this morning is the definition of a person conducting a business or an undertaking. It's a PCBU. This is the definition or the new definition of a business in the Health and Safety at Work Act. And the first step you need to do is to define whether or not you are a PCBU or whether you aren't a PCBU. It's kind of important, and I found in the entertainment industry and in the arts industry there are a lot of voluntary organisations, there are a lot of individuals who are not a business per se, and we need to kind of understand where you fall on the spectrum. And as a second example, the next regulation that's in the ether deals with work participation and the way the Act defines you engage with your employees if you are a PCBU. Again, this is a compulsory mandated engagement with your employees. It's not an option, so you must have a plan around how you do that. So, the approach I've taken is, again, from a voluntary standpoint. So what I've done working with voluntary organisations is to help them determine if they're a voluntary organisation or if they are a PCBU. In the previous slide, we looked about the definition of a PCBU, and I suppose in the PCBU situation, if you're a voluntary organisation, consider yourself a voluntary organisation. If you don't employ anyone, that is, you don't pay any PAYE, then it's likely you're a voluntary organisation. So therefore, if you pay just one person, and that is if you're paying PAYE for one person, and a lot of organisations that may be someone who's employed to manage the books or as a secretary or as a treasurer, you may pay someone in a full-time position to be the treasurer, as I said. If you're paying someone and you're paying PAYE, then just that one engagement means that you're a PCBU. So you could be a voluntary organisation, for instance. You're paying one person in the role of a secretary and you may have 100 volunteers. Your entire business is now defined as a PCBU. Now, if you're a voluntary organisation, you can contract in services. For instance, you're able to employ a director, you're able to employ a choreographer to provide you with services. The thing is, those people that you're employing from a contract basis will be a PCBU in their own right. Now, if you contract services in, you don't become a PCBU because of that mechanism of engagement. You can also pay the expenses of your volunteers, and you can, under the Act, because you're a voluntary organisation and you're not defined as a PCBU, there is no enforceable duties that you have to carry out in terms of the Health and Safety at Work Act. But I assure you that you have a moral obligation to ensure the health and safety of your volunteers. But if you are a PCBU, we've got some work to do now. The Act defines the PCBU as the entity itself, which is the business. And you need to understand how the legislation applies in a vertical sense. So the PCBU is the entity, the business, such as Fred's Sound Company. It has the primary duty of care. Now, it must ensure that through process and procedures that employees are not put at risk or at harm. And it's responsible to ensure hazards are identified and associated risks are managed. Now, I'm just talking about the entity, the PCBU. The mechanism by which it does this is through its officers and its workers. So we're now looking at the business in a vertical sense. So you've got a PCBU, which is the entity. The next layer down is what's defined as the officers. Now, the officers of a business are the ones who make the decisions around how money is spent, how money is generated. They can make a decision around what that business does on a daily basis with its money. And so therefore, because they have that influence of control, they are defined as officers. Now, underneath officers, you have the workers. There are a lot of general managers who perhaps manage a budget, but they don't actually define where that budget comes from. That may come from the board, or it may come from another group of trustees, for instance, and they're just managing a budget. Because they didn't create that budget and they only control it, they would be defined as a worker. Unfortunately, in New Zealand at the moment, we don't have a lot of case law in play around the grey area of officer versus worker. We defer to Australia, where there is some case law in place. But in essence, the way the new Health and Safety at Work Act is structured, the PCBU has responsibilities, the officers have responsibilities, and the workers have responsibilities. And they're all defined in the Act. And when we go through the policy and the Health and Safety Management Plan, we'll refer back to officers and workers. So the PCBU's got to basically also monitor anything, controls it puts in place for effectiveness. You've got to provide the info, the training and the instruction for people to make sure that the actions they do on your behalf don't put themselves or anybody else at harm. You've got to manage the safe use, the handling, the storage of plant. You've basically got to do everything that is reasonably practicable to do to prevent harm. Now, in the legislation, the definition reasonably practicable also includes the line costs that are grossly disproportionate. Again, we don't have a lot of case law around this at the moment, but what they're inferring is if you're a small company, for instance, and you've got a noisy little generator that's going to cost you, a 20 to 30% of your annual budget to replace it, then you can put controls in place around that. So you can build an acoustic chamber for it, for instance, and if you can't afford to do that, because again, it's grossly disproportionate to invest in such an act, but you could then go down the path of personal protective equipment such as earmuffs and hard hats and safety boots and things like that. But that's the last line of defence. The hierarchy of controls that are inferred within the Health and Safety at Work Act ask you to try and do all you can do to eliminate any particular hazard and its associated risk first. Something in particular right now is you should have emergency plans in place. And these emergency plans are not just for the event itself, it should be for post-event situations. So if you're in a theatre, for instance, and you're putting on a production and you've got 2,000 patrons in there, you need to have a plan around how you move those 2,000 patrons outside and also where your responsibility starts and finishes relative to what you are going to manage. Case in point, if we have a big shake here in Wellington and 2,000 people can't go home, what do we do? How do we manage? How do we connect to the emergency services? How do we let emergency services know that we've got 2,000 people clutched up somewhere and we need to do something with them? One of the key elements that I'm going to keep repeating during this little webinar this morning is you must document everything. And that is, you must document everything. And I'll say one last time, you must document everything. The primary reason for that is that you must be able to prove that you were doing what you said you were going to do. Now, there's been about 80 court cases so far this year, and 95% of those court cases, the companies have pleaded guilty to the charges laid by WorkSafe, simply because they could not document, or they could not prove through documentation that they had done what they said they were going to do. So it's a very sort of cognizant thing you must do as a business, is prove that you're doing it. Is there any questions at this stage? Feel free just to leave them in the chat box there. So
if anyone does have a question for Steve, feel free to pop it in the chat box. And if anyone wants to know further information about anything that Steve's covered or wants to ask a specific question related to your organisation, feel free to ask. One of the things I wondered, Steve, is of those 80 charges this year, how many of them relate to the arts and entertainment industry, if any? Do you know?
There are none. There are none.
Okay.
So,
right.
Again, the bulk of them fall in the construction area or forestry, logistics, transport, and also quite a few in the mining, unfortunately, mining areas, quarrying and things like that. But one of the important points to note is, unlike regular court, where you are innocent until proven guilty, health and safety court is very much you must prove your innocence. So therefore, if WorkSafe, for instance, feels like they have a breach or that you're not compliant with the health and safety legislation, they will ask you to prove in court that you are. So therefore, you must bring everything with you to say, well, hey, that where you thought we weren't doing something, we actually were. And I'll give you an example later in the presentation around multiple PCBUs working together and what that means and how you must work together in that sort of environment.
Great. We've got a question here from Anna Boron, who wants to know, are we responsible for people after an emergency evacuation in terms of seeing that everyone gets home safely?
No, good question, Anna. I've just been doing a lot of work with Reader venues down here in Wellington around this very point. We don't actually have a responsibility to them. Your responsibility is to get them out of your venue or your building as quickly as possible and as safely as possible. You do have designated emergency areas. Once you've sort of proven that all your people and everyone is out of the building, you are then able to release those people. But what you will find in an emergency situation where people are unsure or they're looking for reassurance, they will actually turn to you to look for guidance. So therefore, like I stated before, you've got to be able to clearly articulate what those people, or what the options those people have in that emergency situation. They may have to go to higher ground, for instance, so therefore you may need to move people away from, in Venue's case, the Michael Fowler Centre car park and take them up to the terrace because of tsunami warning. You would then move as a pack, but you don't have an individual responsibility as a business to account for those individuals. As in most situations, for the first 72 hours, everyone's kind of on their own a little bit.
Great, thank you. And Joe Newman wants to know, with regards to keeping connected with emergency services, is it a case of informing, for example, the fire department that they're going to have 300 kids in a room in case there's a fire or earthquake, or is it that having a designated safety officer to contact when or if there is an emergency is the right approach?
Yeah, so pre-warning people isn't necessary.
Right.
Because basically the emergency services aren't set up to be able to account for that level of information pre-emergency, sorry. But what your emergency plan should have in place is a tree of people you should notify, be it the teachers themselves who are bringing those kids to your environment, for instance, should have a call tree so that they have able to take control in that situation. You being the event person, for instance, providing that event to those children, you should have had that conversation with them before they get to, as we're getting into what I was talking before, multiple PCBUs working together. You should be able to say, we have a plan in the event of emergency on how we're going to manage the 300 kids because, again, discussed previously, we know that parents will want to get to their children. It's that instinctive nature, so parents will abandon their posts at work to try and get to their children to make sure they're safe. So children is a very interesting example of how we do emergency planning because we have to account for people now trying to migrate into our zone to try and clutch up their kids and take them home or what have you. And that's brings a very valid point too. If you're in a business and you are working alongside colleagues who have children, in your continuity planning, it is likely that they're going to want to leave the site and go to their children. And you're going to be left with, it sounds a bit nasty, you're going to be left with those who don't have children or children are not in the same town as them. They're going to be the people who are going to have to run your business and stand it back up again in the event of emergency.
That's interesting. In terms of organisations that hire venues, and quite a few of Creative New Zealand's clients are non-venue based organisations, what's the kind of role of the hirer versus the role of the venue in terms of health and safety? In other words, if, say, 300 children are coming to see a performance at X venue, is it the venue's responsibility to have a health and safety plan in place in terms of emergencies, or is it the hirer? Kind of what's the sort of delineation of roles there?
Yeah, so we are punching through to another area of my slide deck, and what I'll do is I'll address it. I can address it now very quickly because we do have a little bit of time up our sleeve. So the venue itself will have its health and safety management plan, and that's all about getting people out of the venue. It'll also be about making sure that if someone's hiring a venue to put on a production or a performance, that they're not introducing risk into the venue, so therefore they will ask you about the production you're bringing in and the type of audience that you're going to be bringing in as well, because the difference between an NZSO audience versus a Wiggles audience is quite dramatic in the way we manage risks in a building as well. So therefore you've got the same risk, you've got a performance, but the dynamics change when you look at your audience, for instance. And I can give you some more examples we looked at a situation at a venue here in Wellington where one of the marble tiles in the main foyer had cracked. You couldn't walk on it, so the team looked at the risks associated with walking on it, and their control was to put up some cones with those yellow and black bars on top of the cones to provide a visual barrier to the NZSO audience that were coming in that evening. So what they did is they erected those cones, they erected those barriers, and successfully no one hurt themselves at the NZSO concert that night. It was an obvious thing for adults to determine that that's a no-go zone. However, the next day we had a Wiggles concert, And cones and buzzy bees, as they call them, are perfect gymnasium equipment for children to play on. So what happened overnight was what a control went from to providing a safe area so people didn't walk into a hazardous area became playground equipment for kids. So what the venue had to do was to look at that control they'd put in place and deem it suitable for adults, not suitable for children. If they have children coming to the venue, they had to actually erect a physical barrier through the use of plywood or some other means to allow a better level of control to occur. So that's just an example there of looking at situations and circumstances.
That's great, thank you. And we've got one more question, I think, before we move on, and that's from Christine Argyle, who wants to know the New Zealand String Quartet Trust employs 4 quartet members who are contracted to the New Zealand School of Music at Victoria University as teachers and quartet in residence. In the event of an emergency or accident, who is responsible for them when they are at the university? Is it the New Zealand String Quartet Trust or the New Zealand School of Music, Victoria University?
It's a joint responsibility there because what you've got is the NZSQ Trust, or the 4 quartet members of it are effectively employees of that trust. They're working in a remote location. They're working in a location which is Vic Uni. So in that situation, Vic Uni and the trust should sit around the table and go, look, we want to make sure our members are safe in your environment. Can you please tell us your health and safety management plan to ensure that? And how do we make sure that in the event of emergency that we know that our 4 quartet members are going to be able to be evacuated from there safely? And then within the NZSQ Trust, you need to have a little bit of a plan around in the event of emergency, how do we health check that our employees are okay? Because essentially employees are working remotely. They'll work. I don't know if at Vic Uni they're employed as teachers, so they're also part of the staff there. What you've got to do is sit around the table, talk about it, document the discussion, and agree, here is our little plan of action in the event of an emergency. And then just follow that plan once an emergency occurs, and then confirm that again in writing to each other that everything worked well or whether there are lessons to be learned on the back of that. It's a specific example there of multiple PCBUs having to work together to protect the employees of each. Because we don't want the NZSQ Trust employees creating a hazardous environment for the Vic Uni employees and vice versa. So we want to make sure that each understands the roles and responsibilities they're going to play in the event of emergency and that it's documented. You can't assume in these situations.
That's great. Thank you, Steve. I think given the time, we'll move on. And if anyone else has a question or a comment for Steve as we go, again, feel free to just drop it into the chat box, and we'll have a chance at the end to have a few more questions.
Cool. So I guess right now everyone's breathing in a very controlled fashion or a little bit heavily. Some interesting news. The Health and Safety at Work Act doesn't tell you how to do things in a specific manner. It only tells you that you must do specific things. So therefore, what you must have in place in your business if you're a PCBU is a health and safety management system. And one of the points I want to make about volunteer organisations is, although you may be defined as a volunteer organisation and you don't have the enforceable side of the law of which can come down on you, if you are in the entertainment industry, it is likely that you'll be working with other PCBUs like venues or sound and lighting hire companies or other production companies who may be PCBUs. Now, they won't treat you as a volunteer organisation. They will treat you as if you're a PCBU. So therefore, even though you're a volunteer organisation, it makes good sense to have in place the same level of documentation that a PCBU will have, because you're likely to get asked for it, and you're likely to be, how are you going to manage, what hazards are you bringing into our environment? How are you managing those hazards? And if you haven't got a plan around that, then things will probably start to elongate in terms of timelines and or trust and or understanding of expectation within your organisation to the environment that you're going to be performing or working in. So what I'm going to work through now is the health and safety management system that's commonly used throughout New Zealand and Australia at the moment. It's based on a standard. It's called the ASNZS 4804 2012 standard, and it's all about the establishment of an occupational health and safety management system. And these are the 5 sort of elements that are particular to that. So you have a health and safety policy, and we'll delve into that a little bit more shortly. You have a health and safety management plan or planning, and that's just purely the procedures and processes you're going to put in place around the management of your hazards, your people, your processes, your systems, training, etc. It's a documented methodology of doing that. Then you have an implementation process where you're continually implementing new and improved systems and processes based on learnings. You then have to be able to measure and evaluate these processes to ensure that they're effective and also that they're relevant to you as an organisation. And lastly, the management must, by legislation, review your system to ensure that it's doing what it's meant to do. Harping back to the officer-worker scenario, officers in an organisation or a PCBU have what they call the due diligence responsibility. So therefore, they should be asking questions of management, of middle management and the workers around the effectiveness of process and procedures, around the achievement of goals and objectives, and are looking for proof from within their organisation that the objectives are being met. So we'll just punch on. So, number one, health and safety policy. Like all business policies, whether it's a quality policy or whether it's an environment policy, the health and safety policy is owned and delivered by the business management team. Normally, the CEO has signed off on it. It is a commitment to the application of process and procedure by management, along with a commitment to the necessary resources to achieve the outcomes of the stated policy. So within the policy itself, we'll see a commitment statement from management that they'll do all they can do around health and safety and protecting the workers. They will integrate the health and safety policy into their quality plans, their environment plans, their asset management plans, because all of these other elements, for instance, have a bearing on how we manage health and safety. So it's got to be an integrated thing, not something that sits outside of the normal business systems. It's got to be relevant. So I've seen quite a few health and safety policies that make some pretty grand statements because they've just copied and pasted someone else's policy, and this may be a 2 or 3 man band, and there's no way that as a 2 or 3 man band they'll be able to deliver on what they've actually committed to in their health and safety policy statement. So it's got to be relative to your business and right sized so that you can actually achieve the goals and objectives. I mean, one of the main statements within a policy is around continual improvement. And some people have got more to do around a health and safety policy and framework than others. A lot of people would have had an older health and safety plan based on the 1992 legislation that's now redundant because of the new legislation. And you can evolve those plans into alignment with the new Health and Safety at Work Act, but there's a little bit of work to do there. Compliance is another great big consideration. Not only do you have compliance with the health and safety legislation, but you may have compliance elements relating to building warrant of fitnesses, electrical equipment and the maintenance thereof. So you must ensure that your health and safety policy wraps up a focus on the compliance element. One of the other key elements in the policy is accountability. You've actually got to define who's accountable for the health and safety so that someone is actually putting their hat on the line, and that is normally the CEO of the business. They're normally standing front and centre and putting their hand up and saying, I'm accountable for the success or failure of our health and safety systems. It must include statements around consultation. As I mentioned earlier, there's a regulation actually out that refers to the legislation where it's actually defined that a business must consult with its workers and provide the opportunity for the workers to consult up through the business. And there has to be a voice and there has to be paths to allow health and safety to be robustly discussed and for the outcomes to be agreed and defined as the business moves forward. And sort of lastly, the policy should be biased towards prevention. So the prevention of harm happening should be one of the key aspects of the policy. Now, I do have a health and safety policy that I provide to people to look at outside of this webinar. I'll work with the team at Creative New Zealand to provide links to these sort of documents, and these documents allow you to have a look at how people in our industry are actually applying the legislation, and you feel free to use these documents free of charge as a baseline for moving forward with existing or creating from scratch. So once you have your policy is a statement around what the business is going to do with regards to health and safety. We now move into the health and safety plan. And so if you like, the policy is the what we're going to do, and the plan is the how we're going to do it. And what I have on the slide in front of me here is sort of the minimum that is expected. You've got to go around and look at hazard ID. You've got to ID all your hazards. And a lot of businesses and people have hazard registers now. And this is what I referred to earlier, where people actually have a lot of this information. They know, and they've identified all the hazards in a venue, and they've identified all the hazards relative to production. But we've been really poor at assessing what's the impact if something goes wrong here. What's the risk relative to the outcome? And if the situation changes, what's the risk change then? And a lot of assessments are done now around risk registers where we actually provide a physical rating of risk. So we measure the consequence of the risk. If it happens, what's the consequence? And then we measure the exposure to that risk. And and if you measure those sort of on a basis of 1 to 5, 5 being real, real bad and 1 being not. So, the consequence of this risk is death, and that's a 5. Or the consequence of this risk is I'm probably going to need some first aid, then that's a 1. The exposure is I'm in front of it the whole time, that's a 5. Or I pass by that sort of 1 hour in a day total, so 10% exposure. That sort of means that the first one is a 10, the other one is potentially just a 2 or a 3. So as a business, you start focusing on the 10s or the high risk elements and making sure that your controls you have in place around that, or the methodology you're going to employ to reduce the risk is managed in a very effective manner. Now, controls are things you put in place, like before, the cones and the physical barriers, or it may be a procedure. For instance, you must wear a harness when working at particular heights, or you must, sound engineers must make sure that there's no one in the auditorium when they're line checking their equipment, so that there's no impact on hearing. And most of all, like I said here, your whole framework, your safety management plan, has to have a methodology around proving you do what you say you do. You've got to document everything. In the case of the cones and the barriers, the operations team at the venue took a photograph of it, which is time and date stamped. They file that up against the event so that it's recorded. They went back an hour later to make sure it was still in place, took another photograph, proving that that control was effective. Then they turned up in the morning and they saw kids swinging on it, took a photograph of that and proved to themselves that that control was not effective due to a change in environment. But they documented that whole process. So what they then do on the back of that is they go and have a discussion around the process of barriers around hazards, physical barriers. How do we get the information around the event to make sure that if it's going to be there for a week, that it's a suitable barrier, for instance. So that's the documentation thing. Again, proving you do what you say you do or have done, you've got to document. So therefore, your structure within your business has to have document repositories. It must be structured in a way that it's easily accessible. And again, as I say, if you end up in court, you've got to take that information with you and present it as a means of proving that you accounted for the risk, you were trying to manage the risk, and if something occurred, what's likely to happen in court is your methodology will get credit, your application of control will get credit, and if someone was hurt, you may get a small fine. We're talking $500 to $1,000, and you'll get an improvement notice around making sure that people are suitably qualified, for instance, to make those decisions along that path. So take photos, plan activities, have a toolbox meeting in the morning during a production, which is just everyone get together again and just make sure what's different today from yesterday. What do we need to be aware of today as we go through our day? A bump in week or on a production is the most dangerous. It can take 3 or 4 days to put a production into an environment, and then at the end we try and take it out in sort of hours. So the in and the out are the most dangerous environments, and it needs to be controlled, measured, thought about, discussions had with everybody involved. Again, I can't stress enough that proving you did what you said you were going to do is what you're going to need to do in court. So you're going to have to take photos, you're going to have the documentation with you. Now we get to the multiple PCBU environments, which is something we mentioned during the question session earlier. It is actually mandated in the Health and Safety at Work Act that if you're multiple PCBUs, in other words, you've got multiple businesses working around the common cause, in this case it might be a production, for instance, or a concert or a show, you're actually mandated. You've got to consult, you've got to cooperate and you've got to coordinate all the activities that have risks based around them. So therefore, you've actually got to sit around the table and then produce, if you like, everyone will have their health and safety management plans. You've got to meld those together and make sure that you have a production plan that incorporates all the elements of risk and who's responsible, who gets to call out what. In most instances, you'll find the venue themselves will take the lead on this because they've got the most at risk. So therefore, if you look at it in terms of insurance, the venue itself is carrying probably the greatest level of insurance against the other PCBUs. So they've got the greatest risk if something goes wrong, and they'll have to prove that they've got the methodology in place. So therefore, if you're going to hire a venue, don't be surprised if venues start asking you for your health and safety management plans around your production. They're not asking you for your health and safety management plan around your business. They're actually looking for specifics around your production. They're looking to understand, are you working at height? How is your set constructed? Are you aware that we've got a sloping stage at the Opera House, for instance, and can your set stand on that? Are you going to use fire, pyrotechnics? Are you using knives, guns or swords in your production, and how are you managing those from a props perspective? So all these sort of discussions will be coming and driven by venues, for instance, in this particular instance. But any hall that you're hiring, you should be having that discussion with those people around the health and safety and the management. Typically, you've got public coming to your environment, and if I skip to my next page, in terms of arts and venues and suppliers, who's responsible, you've got to define who's responsible in terms of the new Act, who's taking the lead, who's the principal is the words we used in the old Act, but we don't use that word anymore in the new Act, but we're still using that word. I'll take the principal lead because I've got the most involved. We've got to plan together who, what, where, when. Again, toolbox meetings, and record these. Put your phone on the desk and just record the discussion that's happened and the agreements that have occurred, and then save that audio file. You don't have to actually physically write anything down then, and then file that into your document repository discussed earlier. Safety and design is important, especially in our industry. We've got to make sure that if we're designing sets or designing art installations or we're designing rosters or we're designing a performance, we must make sure that we design something so that it can be built doing no harm, it can be used doing no harm, and it can be deconstructed doing no harm. So therefore, if we're talking scaffold companies, for instance, they've got a methodology, a documented methodology around scaffold is erected, how it's designed, how it's brought down, so that if we're using scaffold in outdoor production, then we've got to work with the scaffold company to make sure that if we're attaching plywood structures to the outside, that we're taking into account wind loadings or weight loadings on the scaffold. That's part of the design process. And in terms of upstream and downstream suppliers, we've got to involve them as early as possible. When I say upstream suppliers, those are like your sound, lighting companies. So they are aware of the environment that they're designing for or they're operating in. They've got to be part of that conversation as well. You've got to do the crisis planning, so although the venues may have emergency plans, you've got to have a discussion about what happens in the emergency, like we talked about earlier in the questions, and make sure everyone's on the same page. And then you've got to communicate it down through the troops to make sure they understand and provide them the opportunity to communicate back up if they feel that it's not going to work or they've been put in a situation where they feel compromised. And again, must document everything. Otherwise, you may find yourself in a difficult situation in court if something was to go wrong. When we look at, and I've done a lot of work in our industry, as I say, for over 40 years, the single biggest risk we have is fatigue and stress. Now, how we manage that or how we identify that is critical in part of our health and safety management planning. For instance, when we look at fatigue as an example, if we're a professional organisation, we've got to plan our rehearsals. We've got to look at the sections of the production that we're actually rehearsing when. Think about, in terms of dancers, how are they exposed? What's their fitness levels relative to what we're asking them to do at rehearsals? We shouldn't be potentially using rehearsals to generate a level of company fitness, for instance. We have to be able to identify fatigue and watch out for fatigue. Understand what the mechanisms are or the precursors of fatigue and stress are. Because on the back of that, you'll start having injuries if you're dancers, for instance, or you'll start finding production crews will be getting very grumpy. And when that thing starts to happen, the level of risk starts to rise because people aren't paying attention to the functions that they're doing, and as a consequence of that, harm is likely to occur. in a volunteer organisation, for instance, people are normally working an 8-hour day, and then you've got them coming to rehearsals at night. That can be a long day for people. So planning out your rehearsal schedules and the types of rehearsals that you're doing when will help play a part in that. And again, document all this so that if something does happen, you're able to say, well, this is what we tried, we managed this is what we learned from our previous situations. And one of the biggest indicators is people actually having accidents driving home after rehearsals or after performances because they're tired. That's where the greatest harm is occurring. And our friends at WorkSafe are paying particular attention now to injuries that happen by people saying, I had an accident heading home from work. They consider that to be a work accident now, and they will investigate as to how someone was able to go home tired and what level of work were they doing during the day. Another element that we need to consider is travel and time zones and overseas work that a lot of us do. We must build in ability to recover. We must be able to document. You can't consider flying on a plane as being a restful experience, for instance. We all know you get off the other end and you're feeling pretty shattered. You can't bust straight into meetings and meeting schedule requirements. You should plan around the health and safety of your people when they're travelling overseas, especially. Noise-induced hearing loss. Working at heights. Working at heights is another big one in industry. Now, most of the suppliers that we have, lighting companies, sound companies, have pretty good procedures around managing working at heights. The issues you come up against are where you're hiring a venue that's a little bit off-grid, in a rural environment. It's a community hall and Bob does all the work there. You've just got to make sure that Bob's working in a safe manner with respect to the production you're putting together or the event that you're holding. You need to call that up. Noise-induced hearing loss. You've got to have plans in place around making sure people aren't exposed to noise over long periods of time. This is a wellness thing rather than an instantaneous health and safety issue. It's a bit like fatigue and stress. It builds up over time. It's not an instantaneous thing, so you've got to manage it. Just like noise-induced hearing loss, you perhaps around your key people have hearing tests as part of your process to ensure that they aren't being impacted by the work they do on a daily basis. The public is one of our biggest hazards. They are an uncontrollable lot. They do their own thing. They move as a pack. And despite our best efforts around command and control in an emergency situation, their flight or fight response comes to the fore, so we've got to take that in consideration. We're always working under suspended loads in theatre. One of the only industries we can do so without a hard hat. A lot of temporary structures erected. Again, we must make sure that they're done so in a manner that's safe and that they can be erected safely, used safely and taken down safely, and pyrotechnics. So these are just examples of hazards that we have to have risk management plans around in our industry. Here's a little video of someone at work doing something that potentially is a little bit dangerous. Now, he's obviously in a very precarious situation right now. He's lost the load off his pallet, but he's a trooper and he's going to try and save this. These are actually milk crates he's working with, but it seems a lot more relevant if you think it's beer or wine. And all his mates are standing around right now watching him thinking, what is this guy, we'll call him Nigel, what's Nigel going to do to get out of this? And he's now putting himself in a much worse situation. But again, Nigel's an employee, whether he's intelligent or not, we will determine as we move through, but he's still going to progress in trying to save this. Bit of a Kiwi mentality here. This is actually not a Kiwi movie, this is an Australian movie. But again, he's persistent, if nothing else, in trying to solve the situation. If you were to look at this scenario in terms of the current legislation, the health and safety legislation, you've actually got a duty to look after yourself and others, and it's stipulated. So you can do no harm. Do not put yourself into a situation where you harm yourself or you harm anyone else. In this instance, our friend Nigel here, he's putting himself in a situation where he's doing himself harm. So at the least, he could actually be fined as a worker for doing that to himself. But what's likely to happen is he'll get fined as a worker for putting himself in that situation. The people who are watching will also get fined because they have a responsibility to call it out. And the business itself is obviously going to get fined because Nigel should not have progressed this or escalated this event by continually trying to work through it. He should have realised he was in a situation due to training, and stopped as quickly as possible. So in this environment here, if someone had actually been seriously hurt, everyone that's involved, including the business itself, the PCBU, would likely end up in court. So call it out, manage the risk, and stop people from doing some silly things. Some stuff you can have for free. I mentioned this previously. I've got worksheets to help you define if you're a PCBU, and I'll provide a link to Creative New Zealand so that they can upload those to their own Dropbox. We'll provide you a link to that Dropbox. Specifically in our industry, I've got 89 hazards, risks, and controls already highlighted and created, and risks rated, so that you can recognise the risks that are greatest in our industry. And I've also got a production checklist that I've given out to help people identify hazards and risks and understand how the likes of venues and other locations. It might not be a venue, it might be a hall, it might be an art installation, let's say, or an outdoor or a council, the types of things that they're going to be asking you. So I've created these pieces of information over the last 2 years. You have them for free. As I say, I do this work in the arts industry for free because of the amount of scaremongering that goes on, and we don't need to perpetuate WorkSafe trooping down the corridor. It's a bit of a myth. There's only about 300 WorkSafe employees. They've investigated they can do about 100 investigations a year at the moment. And as I say, out of those 100 investigations that they've done, or 300 investigations there's 100 employees doing 300 investigations, get my maths right. They're all focused on those high-risk industries: construction, forestry, mining, adventure activities. So there's no focus on the entertainment industry at the moment, but I'm pretty sure as the years move through, they will come looking, and they'll be wanting to understand how we operate. So the ability to get our ducks in a row now is something we should all be working through as a collective. So risk game, like I said earlier, we need to understand: are we rolling the dice here, or are we actually taking a measured approach? Take 5 minutes. That's all it takes. Take 5 minutes in the morning. Think about the situation. Is it different to yesterday? What do we need to know, and how are we going to behave moving forward during the day? Lastly, the WorkSafe website is a fantastic repository of information. There's a heck of a lot of information there. I've seen a lot of their spreadsheets, a lot of their templates sold to people, and you can just come to the WorkSafe website and download them for free. So before you buy a system, or you look at employing someone to sell you something or to build you something, take a look at WorkSafe website. It is a fantastic repository of information. After all, they want everyone to go home safely at the end of each day. So I guess we'll open back up to questions again. There's no more questions coming through. There we go. The Guide to Safe Working Practices in the Theatre and Entertainment is still relevant, is it not? Yeah, good call, Stephen. Yeah, that document was created way back in 2010, 2011, I think, is a fantastic piece of information. It's something that I push out to people on a regular basis. It's very relevant because a lot of the practices or the codes of practice that are referenced in that document are still valid today. They've been refreshed, obviously, for some of the new legislation, but it's a document that people are well worth having in their back pocket in our industry. Oh, I'm just seeing Shockwave Flash has crashed. Screen, I apologise. I'll just try a reload and see what happens, and I'll see if I can get to the questions again shortly. Apologise for this little delay. Thank you, Helen, for putting up the WorkSafe website title there.
Can you do it?
For small organisations, one part-time employee and contracted staff, does the one employee take on the responsibility, or the trustee is responsible? It's a top-down thing. The whole organisation is responsible. So in this situation, if it's a small organisation, the organisation is the PCBU. The trustees would be the officers, and the part-time employees and the contracted staff are the workers. So therefore, you must be a PCBU. And that light, you've got to have a health and safety management plan, and you've got to have process and procedures in place. Again, in the information that I'm providing to Creative New Zealand free of charge, you guys have a look at a health and safety management plan I've got in place, which would just about fit that sort of situation perfectly. It's, as I say, you've got to make sure that things are fit for purpose. You can't go getting a 200-page document for a small organisation like that. You'll just grind yourself to a halt in paperwork. So you just need to ensure that your processes and procedures are relevant to your organisation. We have another question here. Jessica, useful session. Thank you, Jessica. Very much appreciated. What do you do if one of your contractors does not have a health and safety operating manual? Thanks, Lindsay. Good question, because these people need to understand that they are a PCBU and they've got obligations under the law to look after themselves and others. And one of the activities that you should do as an organisation is to do a health check on your suppliers and just see where they're at relative to their process in complying to the health and safety legislation. Now, there are some cowboys out there, and there are some people who are doing the hard yards to make sure that they're lined up. So as an organisation, when you're doing a supplier review, which should happen about every 12 months, you should ask for the latest update of their health and safety management plan. If they haven't got one, you should be asking them, what is it that you don't understand about the new legislation, because working with you is now a risk. Now, if they're a one-man band, one of the things they may do is they may say, well, I'll adopt yours and I'll adapt myself to your health and safety management plan, which is a perfectly acceptable place to go, because it saves a lot of work around the 3 Cs. Yeah, it's a good thing in that respect. Hope that sort of answers that question a little bit. The next couple of webinars, we're going to be delving into the risk management side of things a lot more and peeling back how do you actually assess risk, how do you actually define it in terms of the ratings I talked earlier, how do we apply certain templates around controls, establishment of controls. So yeah, there's a lot of opportunity there to, in the next webinar in February, to really get the nuts and bolts in place around the hazard ID, the risk management.
Thank you so much, Steve. It's been a really valuable session for everybody, so thank you. I think we're almost at time unless anyone else has a final question. If anyone does think of something after the session today, please feel free to contact Grace, Sinclair or myself, and we can always pass those questions through to Steve on your behalf. Thank you so much for joining us today for our very first health and safety webinar, and please take a few minutes to complete this short survey to let us know what you thought of today's webinar and how you might implement some of the information. And we'll certainly circulate that Dropbox link to everyone so you can access the health and safety templates as a baseline, as Steve has mentioned. And yes, do join us for the next one, which is on Valentine's Day 2017, the 14th of February, and we'll send you details nearer the time. Next up is our first Optimise online marketing webinar on the 6th of December, where we ask, is your online marketing measuring up? So we look forward to seeing some of you then, and bye for now. Ka kite anō.